We already met Elmer McCollum because he basically is the father of vitamin A. But in 1921, he also discovered that vitamin D, as present in food, was capable of preventing a disease known as rickets. Rickets is a malformation of the bones, and it first came to light during the Industrial Revolution in England, when children were forced to work in mines where there was no sunshine, and the sky was full of clouds, smoke from all the factories, so there was not much sunshine there either, and this resulted in rickets. Why? Well, we'll see why vitamin D is called the sunshine vitamin. But it was quickly seen that there were some foods that could treat rickets. For example, cod liver oil. Now we know why. That contains vitamin A. Vitamin D. But why do we call vitamin D this sunshine vitamin? Sunshine is just a form of radiation. It cannot contain any sort of vitamin. However, it can trigger a host of chemical reactions that take place in the body, by which vitamin D is formed. So there are precursors in the body, chemicals, that when reacted on by sunlight will unleash a cascade of reactions that eventually causes the formation of vitamin D. We know very well that a lack of vitamin D causes rickets, and even if it isn't as extreme as rickets, a lack of vitamin D causes weak bones, that is osteoporosis. This is why milk, dairy products are supplemented with vitamin D to try to reduce such problems of osteoporosis and breaking of bones, fractures. And you are getting about 100 international units in every glass of milk, which is a significant amount, because that is plenty in order to prevent osteoporosis, of course, if it's taken regularly. So most of the attention with vitamin D has focused on bone formation. And here we have some good evidence, although the evidence is not quite as strong as the promoters of vitamin D supplements make it out. But there are many other claims of benefits for vitamin D. Let's take a look at some of these claims and see what the research actually shows. Well, claim that vitamin D reduces respiratory tract infections, like the cold, for example. There is no clear-cut evidence that this is the case. Yes, there have been the odd papers that have found this, but what we really do in the world of science is look at all of the published activity and come to some sort of conclusion. So yes, it is true that someone will be able to point at one paper in some study somewhere, that showed some benefit. However, when you put together all of the evidence, all of the studies, there is no benefit in respiratory tract infections. There's also the idea that vitamin D can improve depression and mental well-being. There have been a large number of studies as well, and there's no evidence for this. Then there's the claim that vitamin D can prevent or treat arthritis, particularly rheumatoid arthritis. No, we have no evidence of efficacy from number of properly done, randomized, controlled, double-blind trials. What about multiple sclerosis? Yes, it is very inviting to think that it can have an effect. Why is that so? Because there's more multiple sclerosis, higher incidence of disease, the further you are from the equator. And therefore, it stands to reason that there might be a link to lack of sunshine, which in turn links to vitamin D deficiency. But the studies have been done, and it turns out that supplementing with vitamin D does not have a significant clinical benefit for multiple sclerosis. It was a good idea, but it seems that it just hasn't panned out. What about vitamin D just generally reducing mortality, that is the incidence of death, over a period that is being studied? Well, there are some studies that show somewhat of a reduced incidence of people passing away during vitamin D studies where they are taking supplements, but the effect is very small if there is such an effect. And then there's the claim that vitamin D reduces cancer incidence and cancer mortality. Again, unfortunately, the properly randomized trials, double-blind trials, have not shown any benefit. What about the idea that more vitamin D is better, that one hasn't seen the effects because not taking enough? Well, that hasn't panned out either, and in fact, very high doses can actually increase the risk of falls or fractures. How about monitoring for vitamin D in the blood? 25-hydroxyvitamin D is the active form of vitamin D in the blood. And yes, it can be measured, and certainly when someone is very low in vitamin D, supplements are indicated. But you don't need to do a blood test to take a vitamin D supplement because the supplements are safe. And anyway, when tests are carried out, if the amount of vitamin D in the 25-hydroxy version is over 50 nanomoles per liter, then there's enough vitamin D that no supplementation is needed. All right, but now we get back to the bone story. Vitamin D is said to reduce falls, which then of course can result in fractures. And the studies show that it may actually reduce the number of falls among the elderly. And what about the holy grail of reducing fractures? Well, it does reduce fractures, and the research has shown that. There is a reduction when taken at doses greater than 800 international units a day, when taken together with calcium. However, one of the most important measurements when you're looking at effectiveness of a drug or of a dietary supplement is to ask the question, how many patients do you have to treat in order to have one successful result? Well, it turns out that you have to treat about 50 individuals taking vitamin D and calcium every day for 10 years to prevent one fracture. That doesn't sound too impressive. Of course, we're dealing with millions and millions of people. So if you are treating every 50 and preventing one fracture, you're still preventing a significant number of fractures, which means that one can justify taking a vitamin D supplement. And there is absolutely no reason to be concerned about anything up to 1,000 international units. But if you're taking such a supplement, it's better to take it together with calcium, because vitamin D is needed for the absorption of calcium. That is probably its most significant role. You can eat all the calcium you want, but if you don't have sufficient vitamin D, it is not going to be absorbed. So here is one supplement that may be worth taking, especially in climates where there is not much sunshine. Where you have sunshine, 15 minutes of sunshine is enough to generate sufficient vitamin D in the body. But in North America, in the winter, we don't get all that much sunshine, and the sun is at an angle where it has to travel through a lot of the atmosphere, which filters out some of the ultraviolet light. So it is not a bad idea to supplement with vitamin D, at least during the winter.